Hey guys, this is Jessica. I did my project on osteoarthritis. So we'll get started. What is What is arthritis? I should say. Arthritis is not just a single disease, but a collection of diseases that refers to the pain in the joints or joint diseases. There are 100 different types of arthritis diseases. I'm focusing on osteoarthritis, and so it affects people of all ages, from children to the older adult, and there are more than 50 million adults that are affected in the United States and 300,000 children that are affected. This is just with your different types of arthritis. It is more common in women than men, and most commonly it affects adults ages 65 and older. Osteoarthritis is also known as your degenerative joint disease or degenerative arthritis. So it is the most common chronic illness of the joints, and it affects 27 million Americans, which is a lot of people. It can affect any joint, but mostly occurs in the knees, hips, lower back, neck, and other joints, and hands and feet. So it can also affect your shoulder, elbows, pretty much anywhere. And it affects the cartilage that cushions between the joints and the bones that are attached to it. So the cartilage that is in between your joints and that provides stability and cushions your joints wears away and becomes very painful. So here's a picture of a normal joint. You can see there's plenty of cartilage that surrounds the ends of the bones, and the joint capsule looks normal around here, and the synovial fluid around it. So with an osteoarthritis joint, that cartilage is worn away. So essentially you're getting that bone on bone rubbing, which in turn can also rub away that bone. And so there can be a lot of pain in the joint capsule, which causes strain on the muscles and tendons and ligaments that help support that joint. So the etiology and pathogenesis. It is known as the wear and tear. It is the breakdown of cartilage, the articular cartilage, which cushions and supports joints, allowing movement and shock absorption. So, like I said, that cartilage that covers that joint becomes very thin and worn out, and that bone on bone is very painful. So, with that, like I said, it affects the subchondral bone, the menisci, synovium, ligaments, periarticular muscles, and its nerves. So normal articular cartilage is made up of extracellular matrix, which includes water, collagen, proteoglycans, and small amounts of calcium and chondrocytes. So in osteoarthritis, there's a breakdown of the extracellular components and breaks down that collagen that gives that cartilage its sustenance, and there's an increase of chondrocytes, degradative enzymes. So it causes a release of pro-inflammatory cytokines, which causes inflammation. This slows the production of type 2 collagen production and increases release of enzyme metalloprotease. So the result of it is there's increased water content and decreased matrix that makes the cartilage weak and less supportive. So essentially there is less sustenance of that cartilage, which gives it its support and squishiness, and over time that wears away. So continue, the bone underneath the cartilage is affected and wears down and becomes weak. This can cause edema, synovitis, inflammation of that synovial membrane, and it becomes very painful, and a person might lose that range of motion in that joint. Swelling leads to muscle stiffness and weakness along with pain. It affects the tendons and ligaments and the whole joint capsule as a whole. So it's not just affecting the cartilage itself, but it affects that whole joint. So here's a picture of someone's hand, and you can see the swelling in the joints here. This is what a normal knee looks like with the healthy articular cartilage right here. And when it's worn away like this, it can also cause bone spurs, which is caused by the pulling of the muscles over that bone, and it's very painful. So diagnosis, like I said, they're going to look at the current risk factors. The doctor's going to ask about the family medical history, personal medical history, when the pain begins, how long they've had it, other medical issues, location of the pain, how long the pain lasts, like what makes it worse, what makes it better, what kind of activities exacerbates it or makes it better. How does it affect the person's daily living? Are there tasks that normally the person would be able to do that they can't do anymore? Doctor, of course, will ask for any current medications. Then they'll take a physical examination, which includes looking at the range of motion, the tenderness and pain level of that joint, swelling, alignment of the bones, and the body posture. Then the doctor might look at the bone structure with an x-ray, or they'll look at the structure of the joint through an MRI. Blood work is shown not to do a whole lot, but the doctor might order a fluid sample to look at what's going on with the biochemical process of what's going on, and then education after diagnosis. Common symptoms, of course, is pain of the joint, and usually it's persistent. Pain during rest or activity is common. Some people might be, like I said, persistent pain, but does it get worse or better with activity? So you might have the swelling of the joints, inflammation, crepitus, which is that popping or cracking of a joint, and usually it involves pain, sometimes not. Lateral instability with ambulation, so a person might experience instability on their feet or loss of balance. And with the bone structure, it can cause varus or valgus joints, so the joint structure might pull in one direction or the other. With this, common symptoms might be limited range of motion due to tightness and swelling of the muscles that surround that joint. Sedentary lifestyle. So it's hard to tell with, it could be due to somebody being sedentary, which could lead to osteoarthritis, or osteoarthritis could lead to a sedentary lifestyle. So it could be either or. It's common for patients to be overweight, and lack of physical activity or motion can cause osteoarthritis. So, like I said, patient might have difficulty doing ordinary tasks and daily living that they might otherwise have been able to do. So, comment? Risk factors. Age is the biggest factor. Overweight. So weight loss can significantly reduce risk for osteoarthritis for every 10 pounds that are lost. Occupation or sports that require repetitive movement have a lot to do with it. So that motion of doing something over and over and over again can cause that wear and tear. Sedentary lifestyle, like I said before. Women are more likely than men due to hormonal changes later in life, and hereditary. So a person that has a family history of it might be at a higher risk versus somebody that doesn't. Treatment. There is no cure, but a lot of times you are just going to be treating the symptoms. So for drug therapy, you've anti-inflammatory drugs or prescription pain medications that will come from your doctor and prescribed. Topical creams, which includes your lidocaine, your capsaicin creams, and diclofenac gels, which get applied straight to that joint and it gets absorbed through the skin. Your shot injections, which they're just going to prolong maybe having surgery, and usually you have to get a shot every month. So that's your corticosteroids and your hyaluronic acid shots. I don't know if I said that right. And surgery, if a person gets to that point, it might include an arthroscopy where they clean that joint out, or joint replacement. And the biggest treatment is, of course, physical therapy or physical activity. So with physical activity, you're going to try to reduce weight or stress, and therefore reduce the stress on the joints. You're going to try to increase strength of the muscle that surrounds the joint, and which will include improve your balance, your stability, your endurance, your functional activity tolerance, and physical activity is also going to try to increase your range of motion. So, like I said, there is no cure, but we can try to control the pain and maintain the progression of osteoarthritis and hopefully slow that down. So prognosis is the earlier osteoarthritis is managed, the better. So we try to maintain or slow the progression, and control that pain is usually the biggest goal. So unmanaged pain can lead to sedentary lifestyle or obesity and cause other issues from complications of weight gain. So a person that might gain a bunch of weight, for example, can become diabetic, and then you have the health issues from being diabetic. And then outcome is a lot of times surgery, and if your osteoarthritis is unmanaged, it can lead to dependency and somebody having to help you to do normal activities. So that is it. Hope you enjoyed the video and have a wonderful night. Sorry if it's terrible.